Hello, this is Pat Charles here. And so after the fantastic response we had from the previous video, there was a lot of requests to do some occasional updates to keep people informed as to what's been happening with COVID so that people can feel informed. So this time, it'll probably be a bit shorter, but things I'd like to cover. There was a few questions about, can I just clarify what happens with the exposure and the timeline between when you first get exposed to when you first get symptoms, and a bit more about what happens in that time. So then a bit about schools, although that has changed as of today with a new ruling by the state government, a bit about some of the treatments that have been proposed for this, some myths about coronavirus, and then some mistake from last time. So first of all, this question about the exposure and timeline, just to try and make this a little bit clearer. So first of all, there's the issue of exposure. And so what we define as a significant contact with someone who's got coronavirus. So if you're having this picture here on the left-hand side of two people having close face-to-face talk, if that goes on for 15 minutes, we say that's a significant exposure if one of them has coronavirus. If you then go to this picture of the group here, if you're in a situation where you're in a room, someone has coronavirus and you're not particularly having that face-to-face contact with them and hopefully separated from them a bit more than the people in this meeting, then we would consider that a significant exposure if you had 2 hours in that room. However, obviously it doesn't have to take as long as 15 minutes or 2 hours for the virus to transmit. And there's always that issue of maybe somebody has coughed on this table down here, or coughed on the hand, then touched the table, the virus is there, you then come along and touch that table or other surface, and then introduce the virus into your eyes, nose, and mouth from your own hands. And of course, if the, say the gentleman over here coughs straight in this person's face, and then the droplets from his cough go straight into her eyes, nose, or mouth, then that's obviously going to be enough, and it's not going to require a full 15 minutes for that to occur. So the incubation period is the time from over here on the left, when you first have this exposure, to the period of your first symptoms. Now, we know this can be anywhere from as short as 2 to 3 days and up to as long as 14 days. And we know that this period, once you've had your first symptoms, say, we'll take for argument's sake 7 days, from 1 or 2 days before that, then you can find the virus if you do a swab there. And so we assume that people from that time are probably infectious, although presumably less infectious at that time than once you've got symptoms and you're doing a lot of coughing. So people often ask, okay, well, I've been exposed here. It's now 3 days later, and I would like to get tested to find out if I've got it. But the problem is, if you do the test here, the virus is not actually present in your nasal secretions or your oral secretions at that time. So just because you have the test done here and it's negative, that does not mean you don't have it. We couldn't find it until 1 or 2 days before the first symptoms. So that's why if you're in quarantine, it's for the full 14 days. And even if you have a negative test in that time, you're still in quarantine until day 14, because it might be that the virus is still incubating and it's just not yet at a time when you can detect it. So the question about school closures has changed a bit, thanks to a ruling by the state government today to be a bit more strict with the what we call a lockdown for the situation, to try and control transmission of the virus. So we don't really have to say quite so much about this, but I think what is worth saying is that if we look at the priorities for ending transmission here, the things that are going to be most important of all are strict isolation of cases, and probably stricter than we're doing at the moment, strict quarantining of contacts and travellers, and then expanding testing, although that's very limited by certain practicalities of things that we need for that. So there's like test kits, there's some chemicals that we use for the test, and then also just the swabs themselves. They're all in short supply. So unfortunately, we're not going to be able to expand the testing as much as we really should be able to if we're to emulate some of the countries that have had successful responses to COVID. Then on top of that, we need to stop mass gatherings, and particularly for those groups at higher risk. So that's sort of young teenagers to older. So weddings, parties, anything like that. That's all the things that really need to be stepped on quickly to try and control this virus. And yes, school closures is on the list, but it's well down in terms of the priorities as to what we're going to do. And if we only did school closures, that would probably make very little difference in flattening the curve as we're trying to do. So there's been some talk about treatment options for this condition now, and obviously in a situation where we're all very desperate for something to help us out, people are really latching onto these things as, maybe they could be the thing that saves us here. So some of the things have been mentioned. So this combination drug called lopinavir-ritonavir, which is used in HIV therapy. Then chloroquine, which was an anti-malarial drug, and hydroxychloroquine, which is very similar, but is used in some types of conditions that cause joint pains like lupus. And then also the antibiotic azithromycin. So all these things, whilst it's nice that we've got these, maybe these treatment options, at this stage, all we can really say about them is that they probably reduce the rate at which the virus can replicate or multiply itself. But at this stage, we really don't have anything to suggest that they're making people have a better survival in this condition or get better more quickly. So whilst slowing down virus replication might be helpful, perhaps in reducing spread from someone who's got it to other people, I think what we really want is something that's going to make people have better outcomes when they're really sick. And at this stage, I don't think we've got anything to suggest that these drugs are really going to be meeting that. So I don't think we yet have sort of the silver bullet that we want to end this problem. There's some other antiviral drugs down below called remdesivir and favipiravir, a bit hard one to pronounce. And at this stage, there's some suggestions that maybe they're helpful in some of the overseas studies, but we are probably not going to be able to access those very easily in Australia. So I don't think we can rely on these either. So I think we're still a little bit stuck, that the best thing we can do is try and slow transmission. And then really what we're also looking at is setting up some trials around Australia with the drugs mentioned in the top three, to see if we can try and find out whether they really are helping or not. And because if they're not helping, then really it's not that much use in pursuing them further. There's also the question about non-steroidal anti-inflammatory medications like ibuprofen. Initially, there was a report suggesting that maybe these were leading to more severe outcomes in some patients, including young patients. And so that's now been retracted. And so what I think it probably was a case of was people were seeing some young people getting very sick with coronavirus, and then looking at them thinking, gosh, this was a young, healthy person, and they were taking Nurofen for a pain reliever, and then they got very sick. But then I don't think there was kind of really accurate assessment of all the people who did badly and got very sick, how many were taking drugs like these, and how many of the people who got better and just had that kind of mild course, how many of them were taking it. And I think based on that sort of data now, we're saying that there's really probably not much of an extra risk from this type of medication. However, obviously it's not much of a sacrifice to say, look, I'm still concerned, I'm worried, I want to do something else. Sure, don't take it. There's always paracetamol, and that certainly seems to be perfectly safe and effective for that treatment of that early phase of the illness to try and help with the aches and pains. All right, some of the myths about coronavirus that probably need to be dispelled. So things like the weather, the virus can only survive at certain temperature, and once the weather's hotter, it will stop circulating. That's not the case at all. There's many parts of the world having this. Some of those have very hot weather, some have very cold weather, so that's really not a concern. Whether you drink hot or cold drinks, again, there's nothing that's going to do that's going to change your ability to get the virus or not. Rinsing your nose is not going to help you. Whether you can hold your breath for 15 seconds does not mean you do or do not have coronavirus. Petrol bowels are particularly affected. No, that's not the case. Any shared object that multiple people are touching and then you're touching, sure, you should consider that to be a potential source of transmission. Petrol bowels are no different. And of course, if you're touching something that lots of other people are touching, then wash your hands afterwards. And then finally, there's no evidence that mosquitoes have any role in this at all. So they are not considered to be anything of a concern with regards to COVID. Now, with the changing information this coming through so rapidly, I'm certainly going to have things that I say in one talk, which then we'll find out with new information, the information's changed. So just to correct some of the things from previous talks. So one key thing, my nephew Angus, who runs the Life Gone Wild group, he had to point out to me that pangolins are in fact a mammal, not a reptile. So apologies to my nephew Angus. And then I'd also like to say thank you to the staff that are working in the coronavirus area of my hospital, the Austin. So they're working in both the screening clinic, seeing the new patients with potential coronavirus, and also looking after the patients who've got it. Now, obviously, they're concerned about their own health and they're concerned about their own families, but we ask them each day to go in there and see these patients, and they're doing things like taking swabs where you put what's a bit like a cotton bud in someone's nose or throat, and then you will definitely make them cough. And so they're getting coughed straight in the face protection they've got there with potentially coronavirus containing droplets. and they're wearing all that personal protective equipment. So they're getting very hot and sweaty doing this for hours on end. And at the end of the shift, we say, can you come back for another shift? And they do, and they're very happy to help out. And so really want to say thank you. And I'm just amazed at your bravery and your sacrifice. And I think it's really impressive the way the staff are stepping up to look after these sick people. And finally, this is going to be something that's probably here for quite a long time. This is not going to be a matter of a few weeks to sort this out. This is going to take months at the very minimum. So we're here for a while. It's a scary time, and a lot of us are feeling nervous, anxious. And so just got to look after your own sanity. And so think about some things that you can help with that. I think social media, with so many bad news stories there, it's definitely a source of extra anxiety. So maybe set a screen time of the limit on how much social media you're doing each day. Look for other escapes to try and maintain your sanity, whether that's reading a book, or whether it's learning a new language, or going back to a musical instrument, or listening to some podcasts on a topic that you've never learned about before. Think about other ways you can keep yourself sane in this stressful time. And also think about people in need, particularly the elderly. If you've got elderly relatives, friends, or neighbors who maybe aren't going to cope with things like home delivery of supermarket stuff, try and help them out with that. And of course, keep washing your hands. Now, always assume potentially the virus could be on your hands. So before you touch your eyes, nose, and mouth, wash your hands. Soap and water is perfectly good. But if you do have alcohol-based hand sanitizer, that's also great. And if you want to make your own alcohol-based hand sanitizer, the formula on the right there with the 75 mils of something like methylated spirits, or something with a very high alcohol content, with about 20 to 25 mils of water, and then a little bit of glycerin to help it go smoothly over your hands. Or if you can't get glycerin, then a bit of liquid dish soap. And then finally, eventually this will end. So we've had pandemics before, and it will pass. And so just think back to the stories of 1918 to 1920, when we had the Spanish flu epidemic and pandemic, which was obviously a terrible thing at the time. But at the end of that, we did have the Roaring 20s. So maybe there's some things to look forward to. Maybe we're going to have another jazz age and some other legend like the great Josephine Baker. So maybe there's going to be some good news eventually at the end of this. We're just going to have to get through this difficult time. So until next time, thanks very much for listening.